Perfect. So we are also live. Hello, everyone. Welcome to the second episode of NGO Talks. Today we would have with us Pragya Lodha from the Minds Foundation, and we will be talking about the various activities and the work that the Minds Foundation does. I am your host Nitin Shah, CEO and Director of ICHA Support Foundation. I'll probably start with a quick introduction to ICHA Support Foundation and then we move to what Minds Foundation does. ICHA Support Foundation is a non-profit organization focusing on promoting the mental health case, which means bringing about change through awareness, support, and foundation. Our work is based on the belief that raising public awareness, educating communities, and equipping every person with the right tools can foster optimum mental health. Uh, Though obviously our focus is mental health awareness, a major line of work that we do at ICHA Support Foundation is also to act as a facilitator for facilitators, which means our focus is on helping mental health practitioners develop better skills, also helping other NGOs which are working in the area of mental health to get visibility and to spread awareness, right? And that's exactly what we are doing through NGO Talks. One small thing that I would like to mention before we go ahead is that we recently initiated a challenge called the MHP Challenge, which basically is an initiative where mental health practitioners come together and through content are requesting people to visit a mental health practitioner before it's too late. The idea is for all of you to understand that mental health practitioners not only can help you during illnesses, during mental disorders, but they can also help you prevent mental disorders if you reach them at the right time. If you would like to know more about the initiative or if you're a mental health practitioner who would like to support us in that initiative, please check out our website, visit mhp.com. Um, I would also like to introduce the speaker that we have today, Pragya Lodha. She is a clinical psychologist and program director at the Minds Foundation in Mumbai. The Minds Foundation is an NGO that envisions to create a stigma free community that fosters a shared approach to mental wellness, free of shame and embarrassment. So, welcome, Pragya.
Hi, Nathan.
Hi, and I would like to just start by asking you to give me a brief introduction about yourself. I've given like a really small, really brief introduction, but if you could speak a couple of more things about yourself and also about the Minds Foundation.
Sure. I think I would just say that I am a practicing clinical psychologist. I am a young mental health professional. I work and have been working in the space of mental health for about 4 years now, formally and informally, online and off ground. I'm presently based out of Bombay and I work with a couple of organizations with a similar vision of working towards mental health. Um, I think that's all about myself. Uh, the Minds Foundation is one of the first organizations in India, one of the first NGOs rather in India, that has started working and envisioning towards rural mental health, which was not a topic that was spoken about almost quite some time back. We're finishing 10 years now with our work in rural mental health and community mental health. Like how you already pointed out, that the Minds Foundation envisions to create a stigma free world, and with each initiative that we take at the Minds Foundation, be it in the education sector, be it in the awareness sector, be it through research, be it through our community work, our aim is to make mental health an easily talked about topic by one and all, where people don't feel shame, where people don't feel resistance, and where people don't feel the need to constantly shy away from talking about their mental health or mental health in general as a topic as well. Like I said, that the Minds Foundation is finishing 10 years. We're finishing a decade very soon, and we've been working largely from Gujarat. Our major community operations are in Gujarat. I work in Bombay, and we have operations in the USA as well. So I started off actually my journey with Minds. I think in 2015 as a summer fellow, and now I've been working with them for 3.5 years now. Started working as a content and program developer, and then was with time promoted as the program director for the Bombay chapter. So yeah, in Bombay, to briefly touch upon, we do community work, but the community work is slightly different in terms of awareness lectures and training programs, and we focus a bit more on research in Bombay versus what we do in Gujarat is that we do a lot more community work there, since we work in the villages directly, one on one. So I think that would be a brief about Men's Foundation.
Okay, perfect. Thank you for introducing both yourself and the Minds Foundation for us and the different activities that they're doing. Um, would you be able to give me a bit more details about the additional activities that you do? So you've given me a brief idea about the things that you do in Gujarat and in Mumbai, but if you have to
Right.
kind of elaborate on those activities, how would you do that?
Sure. So basically, we look at work in various verticals. The first vertical is the community mental health work that we do, where, like I said, that we work on a one-on-one basis, where we go to villages. We are one of the only NGOs that also do door-to-door services of serving people, talking to people, and bringing awareness from house to house in these villages. Um, Till date, we've covered a population of about almost, I think, more than 1.5 lakh people in more than 163 villages. So, what we basically do in community mental health work is that we go from communities to communities, we gather people, we do a film screening that we have made at our foundation, and we start a conversation with that movie screening. Also, in the villages, we help people connect in the sense that we act as mediators to identify people who need the mental health help, and we direct them to a municipal hospital that we work with. We have a formal established association with them, and that's where they get directed to. So we take care of the transport of people from the villages to the hospital. We also take care of the medication that is provided to them in case people are not able to afford them. The municipal hospitals take care that medication and the mental health services are provided at a reasonable and affordable rate. So that is a one aspect of community mental health. The second one is also that we work with local community leaders, where we train people and Asha and Anganwadi workers to become community mental health leaders, where they do the similar thing of bringing and expanding awareness, identifying people who need help, and then they connect those people to us, and we take the help forward to the hospital. So that is one angle of our major work in the rural parts of Gujarat, is that of community work. The other work that we do has got to do with research. We have worked on extensive research projects with various national and international college students on various topics that either they bring in concern or we work on in the rural communities that we work in. And the research is also something, like I mentioned, that we do in Mumbai as well. The third component that we work on is school mental health. Till date, we've done actually awareness for more than 35,000 students in school, and reached more than 1,500 teachers to train them in school mental health. So that is one another area of our work. Another niche of area that we're trying to also expand is corporate wellness and corporate mental health, where we are trying to take mental health and bring mental health to the corporate sector as well. And the last bit is the awareness psychoeducation and the online campaigns that we run with students, with other organizations, and ourselves as an organization as well. We have a campaign called as MH for All, and Rise Up that we started. Rise Up started last year. MH for All has been around for a while, and that's where we bring awareness about mental health and bring awareness about suicide prevention to one and all at a community level. So these are the large verticals that we work on at Minds Foundation.
That's quite interesting, and that's a lot of work that you guys are doing. So, thank you for being here with us and sharing all of these activities that we're talking about right now. Pragya, In the NGO work that you're doing, what are the key challenges that you have faced?
Well, I think one of the key challenges, especially when I'm looking at community work in rural parts, is that though we are aiming for awareness and though we have reached quite a large number of people when it comes to awareness, I think the challenge again remains because we as an organization um, have also managed to reach villages that are 40 and 50 kilometers away. But still, to reach each and every part of communities, especially in far and remote placed areas, is still a challenge. Because, I mean, sometimes it's just transport, sometimes maybe people are not willing, sometimes. I mean, there are other challenges also, such as maybe we may not have funding available to cover, each and every area as well. Which brings me to another challenge, that of funding, is that though there are sources of funding and there are a lot of individuals who do choose to support the cause of mental health, we still do face a challenge to sort of provide and get, I think, the local community help that we are getting, because the challenge is also that we have to cover like transportation, counseling costs, therapy costs, medication costs. We also provide for one meal to all our patients when we take them to the hospital. Arranging for the transport is sometimes difficult. So, local funding resources are a challenge as well. The third challenge is also, I think, just in general, the infrastructure in rural places, because I mean, I personally have also realized that getting people from far off places, collecting them at one point of time, ensuring that everyone is able to be present at that one time to be taken to the hospital, which is also quite far away, is a challenge. So, the accessibility to healthcare infrastructure is something which remains a challenge at the systemic level. So, we really hope, and we are trying to get in touch with the government to work in a way that there are some healthcare basic infrastructures that could be installed where people can get at least some form of formal or informal healthcare, so that at least there is some sort of emergency and crisis help available. The fourth kind of challenge that we face is to be able to retain quality professionals working in rural areas, because sometimes, even when incentives are there, I think the challenge of working in rural areas is not something that I think we have found very easily, though we have social workers and psychologists who have worked, but it's difficult to retain them to work because, of course, the situation in which we work is slightly challenging. I do remember that traveling to villages can sometimes be difficult. Sometimes, when you're covering larger areas, it can be extremely tiring. And talking to people especially, and connecting with people from rural communities can be a challenge. We don't find a lot of mental health professionals, especially young ones, who would be willing to give in so much of time and also, be persistently available to work in rural areas. So I think that would be these would be some of the major challenges that we faced as an organization.
Okay. And and how about funding? Matlab, how do you work on the funding bit, and how do you take care of that particular challenge?
Usually, I think, like I said, that funding mostly comes in with individual supporters where people like to support. So, I mean, we've had right from students who wanted to support us through maybe film fests or maybe their independent art exhibitions. And these are basically the funds that we need for our day to day operations, especially in the communities. Even something, I mean, the Bombay chapter is still recent. I'm still trying to grow our work in Mumbai, and that also remains to be a challenge. So, like I said, that local funding sometimes can be difficult because we also have to take care as to then what kind of projects we're taking out, how many projects we're taking up. So that is an aspect. So coming back to where does the funding then really come from? Then it does come like this: like we either do fundraisers ourselves. We have been trying to tap into CSR as well. So that is again, I think, a more novel and new area that we are looking into now, because though I think we say that yes, CSR is available and a lot of people are there to support mental health, the accessibility is not as easy. So till now, I think the major support has come in from individuals who've been supportive of the cause for local activities that we do.
Okay. And other challenges that you mentioned, how do you go about working with each of those challenges?
Well, I think, say, suppose if we take how do we retain people, quality professionals. In Gujarat, we have a working office where we also have space for our social workers to stay. But sometimes, because of the location, they may have a lot to travel. So, though there are incentives in terms of flexibility of work, in terms of maybe the stipend that they receive, in terms of maybe having a lot of support from our program director, who also does a lot of work in Gujarat in the communities. He's the person who's actually very supportive. He has been very very instrumental in doing these trainings for our teachers, for community mental health workers, for and even. I think we as a community, something that I wouldn't hesitate to say is that we are a mixed group and we do find a lot of friendly approach. So I think that has been one factor that has also kept all our members going. So and that is something which we also try and sort of meet our challenge in a way that we try making our projects also more flexible. And but again, like I said, that the challenge does remain because I mean, as an organization, we've always looked forward to expanding our work in terms of reaching the remotest village possible as well. So a lot of times, I mean, our program director from Gujarat, that's Mr. Amol Joshi, he also reaches out and goes ahead and does the work. So we share our responsibilities. We take up roles that we are also, like, apart from our formally designed roles, we also take up roles to sort of meet our challenges as and when the need arises. Um, as far as I think the healthcare infrastructure is concerned, I think it's a challenge at the systemic level. But like I mentioned, what we do is that we arrange for transport, we take our patients to the hospital. We also have been successful in following up with each and every patient of ours in the last 10 years, where we ourselves personally go to the villages and follow up on our follow up. Routines to check whether medication is there or no, and our local community mental health leaders also help us to notify when medication is needed, when a follow-up appointment is there. So we arrange for the transport accordingly. Like I said, that we also take care of medical costs as and when it is needed and as and when it is expected from the patients as well. So I think that is one thing that we do as well. So yeah, I think this is the way how we've been managing so far to meet our challenges, but definitely looking forward to maybe more resources to also see better ways to solve our existing problems and make them more sustainable.
And in terms of counseling and therapy, what kind of matlab, is there a particular format that you follow when it comes to counseling and therapy, or how does that go about?
Right. Basically, so we usually the patients who go to the hospital, they receive therapy for free from the social worker and the counselors at the hospital. We have a clinical psychologist on our team, apart from me also, who is working in Gujarat and provides for therapy over there for the villagers who need it. Apart from that, we also have a helpline that is available in multiple languages that people can reach out to. Presently, I think in the pandemic situation where there hasn't been a lot of travel to the hospitals, we have also, like, I mean, I think Mr. Joshi has done a wonderful job of actually recording podcasts and sending them to community leaders. And what they do is that the community leaders go in the villages, they get the people together and they play the podcast. So that's how we've been in touch with our communities during the lockdown period. So
Ah,
that's how we generally go about our counseling and therapy services.
that's quite interesting. And uh, the the kind of volunteer work that you look for. So, what is the role of the volunteers generally, and do you take interns? What's the role of the interns?
Yes, we do take interns. We usually take interns as research associates to help us with research. We take interns also to help us with content writing. We blog also on our website with the Better India, and we also like blog with other organizations as and when needed. We also do a lot of other content work for other organizations and our organizations as well, like creating awareness material, manuals, and written content that helps in psychoeducation and awareness. So that's another area where our interns help us in. The third area is that in community work. So what we do is that we have a fellowship called as the Minds Lab, where students can apply, go learn, visit the communities, take part in awareness and training programs, conduct research, actually stay with us in our office as well, and be a part of the learning that way. So that way they also learn and they also add learning to us as an organization. So these are the three main areas where we involve our interns. As far as I think social media goes, PR goes, communication goes, admin work goes, we already have roles in place as of now. We do get applications. Most of them are for the fellowship. Otherwise, we also, at least in Bombay, this is something that I've been doing, is where we've taken interns on the basis of projects as well. So sometimes students are also looking for 3-month internships, 4-month internships, 6-month internships. So we engage them in our current projects also accordingly, and then have that kind of a flexible model as well with interning.
Huh. And internship with respect to counseling and psychology?
No, the areas that I mentioned, that research, we have writing, and then we have the community work in Gujarat.
Okay.
So as of now, not with counseling and psychotherapy. The cases, I mean, the people who sort of come for the need to get psychological or psychotherapeutic help through our foundation, it's largely taken up by me in Bombay and by our team in Gujarat as well. So as of now, we haven't really taken to take up students for that kind of help.
Okay. All right. And so if I have to ask you, why should people know about the Minds Foundation? What is that one or two things because of which everyone should know about Minds Foundation? What would those reasons be?
Right. One of the things that I would say is that the Minds Foundation is one of the few organizations, like I said, that is working for the field of rural mental health and community mental health, which I think is a greater need, because if we look at our overall national or pan national communities, community living is still a big thing in India. We may live in urban areas, we may live in, like, upgraded towns and cities, but there is still a need for community mental health to be able to get molded. And I feel, as a clinical psychologist, that community mental health is something that can be molded not just in rural areas but in urban areas as well, because at the heart of it, community mental health is something where we address and we take mental health to one and all in the communities. So, since the need for mental health is ever growing, there is always space for everyone to take part, to be part of, and to support the cause of mental health. Especially, I think, in times like now, when there is more and more realization about how important mental health is. Secondly, the thing is that I think all our interns, whether they've been from international universities, or like if we've had local nationals also work with us, we've found from their feedback and testimonials that as much as they give to the organization, there's also always to take back, because I think as a team we do invest a lot in making sure that all interns, all our volunteers, and all our team members equally also learn as much as what they give to the organization. And there is a special focus on what the volunteers and what the people working with us also take away from us. We have ended up also having a lot of testimonials where people have showed interest to work with us on a long term basis as well. Unfortunately, we haven't been able to translate all of that, but we do take genuine care of ensuring that we do stay in touch with them in some way or the other. And we've had a great community base of volunteers till now, which has been, I mean, incredibly heartwarming for both us as an organization and for them as well. So yeah, I think it's great to work towards a greater and wider community of people who can become mental health advocates and who can support mental health as a as a cause, not just on a national but on a global level.
I actually think that's quite interesting because even for us, I think the kind of volunteer work that people have done for us and the fact that the team supports the entire thing, that's probably the only reason why we have been able to do what we are doing right now. So to that extent, that team and taking care of the team becomes extremely, extremely important. Um,
True.
Also, when you talk about, so one of the challenges that I have actually noticed in working during mental in the area of mental health and as an NGO in the mental health is, I've always noticed there are NGOs who are working, but they're all working at an individual level. So we all face similar set of challenges. We all are trying to achieve kind of a similar outcome, but there is no cohesive work where different NGOs can kind of come together, work together towards achieving the overall objective that we are working towards. And hopefully, that's one of the areas that I think there's something that we can probably work on, where multiple NGOs working in the area of mental health can come together, can collaborate, and can help each other grow further and accomplish whatever individual objectives that we are working on.
Right. Um, I think if I have to be a little honest about this, I would say that it is true, because I think every organization, every NGO wants to promote themselves. But I think we are in an age where collaboration is key to expand, because if we are able to realize that our missions may be different, but I think our visions are the similar. Whether it's about reducing stigma, becoming stigma free, increasing mental health awareness, reaching to as many people as we can, mm, etc., etc. I think at the end of it, we're all trying to deal with mental health in a way that we want to make it a more easily conversed topic. So I mean, I think I would share that in my tenure of 3.5 years, we have worked with a lot of organizations and NGOs with a lot of successful outcome. Uh, some have managed to sustain, some associations have managed to sustain, some have been more project oriented, and till now, at least, I think the fallout happens when maybe the kind of end goal that we are looking at becomes slightly different. And I mean, as a person and as a professional, I would say that I do respect the kind of end goals, outcomes, and visions that people and organizations come to. But I think in a time like today, we all need to think about that. What are the reasons that we would like to really stay and continue association, than to drop out by giving reasons and leaving out. So it's very important to look for a common cause and make it a cause to stay together. And explore that how can we actually grow together, because I think there every organization, every individual is going to have some or the other different I think mindset and vision for themselves and their organizations. But it's important to have that kind of flexibility to accommodate one another and see that are we willing to, and how can we find a space to work together. So I think that would be key in a time like today, because holding hands and walking together is only going to bring our communities together, which will help serve the purpose that we're all working towards.
Perfect. So I was about to ask you, how would you like other people to support you? But before that, how would you want other NGOs to support you? So if there was a collaboration that was happening between, let's say, the Minds Foundation and another NGO, both working in the area of mental health, what would you see as the support that you would require from their side?
I think till now, like I mentioned, that associations have been very fruitful, and I think even if two NGOs come together, they may have different goals and different short-term goals and different long-term goals as well. It's important to, I think, also have space for building more ideas and building more space within our goals to see if we can work together, because at the end of it, reaching communities and bringing our skill sets together is important. Say suppose I think one of the things that I would say is that maybe right now we've been working with communities, and maybe like bringing education as a big sector in these communities would be really helpful. So maybe if there is an NGO that works in the sector of education or mental health education, we can come together, find local and common communities to work with, and add more skill sets to each other. So I think since we're also in an age of specialization, we can really use our own work and see that how can we bring benefit to the other NGO, and then find a space for collaboration. So I think that would be a possibility for sure for two NGOs to work together.
That's that's really probably I'll think something on those lines and get back to you with respect to the collaboration part of it. Also, with respect to other support that you receive. So, what kind of a support are you looking for from people in general to the Minds Foundation?
Uh, People, when you say like, are you just speaking about like generally everyone, or I mean, how are we looking at a stakeholder or just the
So, I'm
community?
looking at both. One, general population, if they want to support a cause and if they can support in any way, what would be that support?
Okay.
Second would be, uh, let's say, a support from government. What would that support be? So both people in general and individual stakeholders. What kind of a support would you expect from them?
Okay. I think people and communities in general, the biggest support that communities can bring to organizations like ours who are working in the field of mental health is to maybe become associated, or even if not associated, I think what's important is to be able to reach the vision, whether you have a formal collaboration or no, but to have a kind of acceptance towards what we're working on, and provide support in whatever, however manner they can. Like if I have to tell you, like a lot of people do write to us, not only just as interns, but sometimes a lot of people just write to us, a lot of students also, that we are just really passionate about this cause. And what we do is that we allow them to have certain kinds of experiences with us on the basis of what kind of skill set that they can offer. And if there is a project that they would like to get associated with, an online campaign, or if they want to maybe say, suppose, bring mental health to their school or to their college, we've organized for maybe like talks or webinars or sessions. So this is one way how people can get connected to us if they think that they want to reach out and maybe find somebody to speak about mental health and to bring mental health in their communities. They can reach out to us, and that's where their intention and our work can come together to serve the purpose that we're looking at. In terms of stakeholders like the government, like I mentioned, that I think working towards garnering more funds to develop local healthcare infrastructure, especially in the rural communities, is going to be one of our major future visions and plans to be working towards, because it is a growing need, and I believe it's not just a growing need, but it's been a very vital need ever since. But we know how we have always had a lack of health infrastructure in general. And I think maybe you, and along with every other person working in the space of mental health, whether as an individual or whether as an organization, we've always felt the need for better facilitation of funds towards mental health as a health sector in itself. So I think one would be that, and maybe also a government support in terms of uh, expanding mental health as a cause in a way that actually benefits a lot of people. Sometimes I think it's important to not just talk about mental health, but to talk about mental health in a right manner, which is also extremely helpful, is something, because I think government is one of the major stakeholders that plays a very, very huge impact on the nation as a whole. So also more visibility to mental health in terms of policies, more visibility to mental health in terms of um, I mean, we all know we've been endlessly talking about the Mental Health Care Act. We've been talking about the insurance policies. We've been talking about state and national mental health programs, district mental health programs. So definitely, I think as a professional and as somebody who's really dedicated to the cause of mental health, I feel there definitely needs to be a lot more done. Right beginning, I think from the district mental health level, if governments at the district level can take care of what's happening in respective district areas, I think a lot more work will happen in the favor of people who really need mental health support. and will really help in a very big way to lessen the treatment gap that presently is a very, very wide number in our country, especially given that how many people need the help and how many people don't get the help, and also that our infrastructure in general is pretty low to be able to meet these needs. So I feel the government can be instrumental in starting right from the district level, even if not at the national level. So I think, yeah.
Okay, brilliant. And so when we are talking about, for example, spreading awareness and so on, so in the beginning, when I spoke about the mental health practitioner challenge, that's exactly what we kind of have attempted to do with that, where we are requesting. So it actually began like a small activity where I nominated five of people who we knew that I would create content on a daily basis, requesting people to visit a mental health practitioner. And then we requested them to create more content and they nominated more people based on that. So it's kind of done better than what we expected, but we are now hoping that obviously more and more people can join in, can help us spread the word. And the challenge is kind of very simple to just post something every day on your social media profile asking people to visit a mental health practitioner before it's too late,
Okay.
right? So
Really
that's
wonderful. Yeah.
that's one of the ways in which we are looking at spreading the word about visiting mental health practitioner, because what you said is right, that while a lot of us talk about mental health, and it's kind of, it would be wrong to say that people don't have awareness about mental health, but people still are not willing to seek help. While they know that it's probably important, but they're still resistant. They hesitate seeking help from mental health practitioners. And our objective, both through NGO talks and the other initiatives that we are taking, to an extent, is also to normalize the need for seeking help. That all right, if I want to visit, if I can visit a doctor, I can also visit a mental health practitioner, and that's exactly what we are kind of attempting to do with some of the activities that we are doing. Um, Perfect. And another thing that I wanted to ask you is, individually as a person, now that you're working in this area of mental health, have there been changes that you have experienced, certain experiences that you have had that make you feel that as a person you have changed because of the work that you are doing?
Mm, I think I was someone who was always sure about coming to the space of psychology and mental health ever since my 10th grade. So it I mean the change that I would say is that I am far more enthusiastic. I'm far more dedicated to the cause. I have definitely grown as a person because I've had the opportunity to work with some wonderful mentors, some wonderful organizations who have made me, I think, far more educated, far more sensitized, and far more skilled and equipped to be able to be of help to other people. So if a change that I see in myself, I think it would be this, that I do understand, like, one thing that I know, that when I was studying psychology and when I took it up as a subject, I always used to think, and wonder whether I will ever have, a job, or will I be able to do anything, because I would never know. Like, there was so much of conversation about mental health, but later I think, especially in the last 1 decade, the conversation around mental health has definitely picked up far more. In a much bigger manner, thanks to, of course, like social media and a lot more initiatives that have actually catalyzed the same. So I would definitely say that I think I've become far more responsible, I've become far more dedicated, far more enthusiastic as a person and as a professional in the field.
Perfect. And would you be able to share your future plans with us in terms of both the Minds Foundation and your future plans, if there are any?
Well, in the future, like I mentioned, that one of our associations that we've started and we've rather been working on for a while is to establish some sort of association and work with the local governments to be able to support our communities in a much stronger way. So that is one of our definite future plans. The other is to also grow mental health as and mental well-being rather as a topic, as a need in the corporate spaces through our well-being programs and reach more people. I think the quest to reach and talk about mental health awareness and psychoeducation is going to be a forerunner, no matter which sector we work in, the community, the corporates, the schools, wherever we work in, that is definitely going to stay and only going to amplify and increase with time. So that, and yes, I think each initiative that we take up is geared towards the similar vision and mission that we have, is that every initiative that reaches out to a different group of people, we are able to create that conversation which is responsible, sensitive, around mental health, and is also able to help people come out and take one step to address their mental health or address mental health around them as well. So as of now, I think our future plans is definitely this. Considering the pandemic situation and the lockdown, our very immediate plans that we are presently working on is to also look at a more sustainable and a more, I think, bridged approach to working with our communities. Right now, we only have been managing, but I think it's been difficult because a lot of villages are also not allowing people to come from outside. So we're working towards connecting with our communities back. We're also trying to reach more communities and take help how much ever we can. And the larger future plan is to definitely work at the governmental level, because a systemic change and a systemic association is required so that we're able to help a larger mass of people. Because again, like I said, that rural mental health is not something that a lot of organizations and people really work in. We do find a lot of social work that happens in rural areas, but mental health is still, I think, restricted. So that definitely is one of our aims to amplify in the coming future, in association with organizations and individuals in the rural and the semi-urban and if urban areas as well.
Okay, perfect. Um, so thank you very much for sharing all of these details with us. I hope you have found this conversation interesting, useful, and I really hope that it does help you reach out to a larger audience and help them understand the kind of work that the Minds Foundation is doing. Uh, Anything that you would like to add in the end before we end the session?
I think I would just say this, that as a mental health professional, I don't know if I should say happy, but I am definitely glad in a way that people have come out to take help. And I really hope that this only continues, and people keep taking care of themselves and don't wait for another halt in their lives to be able to address their mental health. And one thing that I would say is that stigma is uprooted even if you have taken help without announcing it to anybody else. So, the biggest stigma that we have to fight against is the one with our own, is that if you need help, please go out and seek it. There is help available. There are lots of individuals, lots of practitioners, lots of organizations willing to help people out there. And it's okay if you do not want to let other people know. So, even if one person is able to step out and take help and help themselves, I think that's where we're getting at. So, yeah, that's all.
Thank you. Brilliant. So you have just kind of already said what I wanted you to say in the end. That as a part of the MHP challenge, we are also requesting everyone to request other people to visit a mental health practitioner. And one small thing is to commit that if I personally ever require the need to visit a mental health practitioner because I feel that maybe I'm a bit too overwhelmed, maybe because I'm having my own emotional issues, then I commit that I will visit a mental health practitioner. So it would be great if you could please make that announcement as well, because that also kind of makes people realize that if mental health practitioners are willing to visit other mental health practitioners, then it's okay to visit a mental health practitioner.
Yes, it's absolutely okay. At the end of it, we're all humans. So, yes, as a mental health practitioner, if I ever feel that I need to take help, I will also seek for mental health help for myself.
Thank you. So thank you very much for being here with us, for joining us in this for this talk, for this conversation. Uh, I would really like to thank all the people who have been on the live, who have watched the live, to be there. If you have any questions, then please get in touch with us, and we would be more than happy to respond to those questions. Also, Pragya, if I may just ask, if people have to connect with you, how do they get in touch with you?
Our email ID, our website is www.mindsfoundation.org. It has my email address, it has the organization's email address, so we're just one email away.
Perfect. So it's www.mindsfoundation.org, right?
Dot- Yes.
So for all of you who are on the live right now, I'm posting it in the comment section. You can please check it out from there. Please feel free to visit the Minds Foundation in case you can help them, support them in any way in which you can. And if you're seeking help and if you would like to visit them to seek help, please go ahead. That's the objective with which they've set up the entire foundation. So I hope it's been interesting, it's been useful, and I'll see you all next week, same time, 7:30, highlighting the work of another NGO who has been working in the area of mental health. Thank you.